Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Tear film test, and this is for the diagnosis of the dry eye. So to begin with, we look at the Schirmer test. Schirmer test. So Schirmer test, the inference will be. So what is the inference? Inference will be 15 mm. So 15 mm stands for it being normal. Next is 5 to 10 mm. So 15 means normal, 5 to 10 mm means it has moderate. So there's moderate KCS. So this KCS stands for the keratoconjunctivitis sicca. Keratoconjunctivitis sicca. And less than 5 mm. So less than 5 mm means it is a severe form of the. Next is we look at the tear. The tear film breakup test. So the tear film breakup test. So TBUT. So how is the inference here? So inference here, it stands for 15 to 35 seconds. So in terms it is 15 to 35 seconds, it is normal. Next is when you look at less than 10 seconds. So less than 10 seconds stands for the unstable. So there's unstable tear film. So 15 to 35 means it is normal, less than 10 seconds means it is unstable tear film. Then we move on to the rose Bengal staining. So in terms of the rose Bengal staining, there are three patterns, that is A, B and C. So A stands for the confluent staining. So this is confluent staining. So confluent staining refers to the severe form of the illness. So it is severe. Next is we look at B. B stands for the extensive staining. So A is the confluent staining, B is the extensive staining. Extensive staining means that it is moderate KCS, that is keratoconjunctivitis sicca. Then next is the C pattern. The C pattern is the fine punctate stains. So severe means it's confluent staining, B means extensive staining, moderate. C stands for the fine punctate stain. Fine punctate stain. This is nothing but the mild KCS. Next, we move on to the tear osmolarity test. So tear osmolarity test. Here it is abnormal osmolarity. There is abnormal osmolarity. So this is defined by the elevated reading. So there is a significant elevated read. So there will be an elevated reading, and this will be greater than 300 milliosmoliter per liter, and then there is an indication indicating the loss of the hemostasis. So increase in the reading, there is a significant increase in reading. It indicates greater than 300 milliosmoliter per, and then it indicates the loss of hemostasis. Next is when the inter-eye difference is greater than 8. So in terms of the inter-eye. So if you look at the inter-eye difference, it being greater than 8 milliosmoliter, and here it indicates the instability of the tear film. So if it is greater than 300, it indicates the loss of homeostasis, and in terms of the inner eye difference being greater than 8, it indicates the unstable tear film. So this is unstable tear film. To learn and grow daily like this, please do subscribe.